Hi, welcome to my talk on a career in dermatology. My name is Ikra and I'm a dermatology registrar in the UK. I'm also the DermReg on Instagram, and you can follow my Instagram page for an insight into a career in dermatology as well as dermatology related education. Through this talk, I'll be covering more about what a career in dermatology involves, including a typical day as a dermatology registrar or consultant. I'll also be talking about the application process to apply for this speciality, and most importantly, I will also be covering how to make your CV as competitive as possible. So firstly, just a bit of an introduction to dermatology. It is one of the most competitive medical specialities, but in my opinion, it's also one of the most exciting and varied. Competition ratios vary year on year, and normally they tend to be around 1 to 4. So for each space, there are around 4 applicants. Dermatology is a good mix of medicine and surgery. You have the opportunity to do dermatological procedures in the day theatre and also see patients in clinic and on the ward. We treat a variety of patients of all ages and of all genders, so newborns to elderly patients, both male and female. The speciality is mostly outpatient based and it is very busy. After completing dermatology training, there is the opportunity to subspecialise. There are a number of post-CCT fellowships which are offered across the country, and I have listed these on this slide. There are also a number of other subspecialist interest areas which you can pursue through attachments and placements in these areas if they are of interest. Here you can see what a typical week in the life of a dermatology registrar would look like, and this is actually my timetable from last year. So as you can see, on Monday in the morning I would have a general dermatology clinic where I would see a variety of conditions ranging from eczema, psoriasis to alopecia, lupus. In the afternoon, at lunchtime, there would be a skin cancer MDT. So this is a meeting where a number of different specialists meet, including dermatologists, oncologists, plastic surgeons, oculoplastics, to discuss difficult to treat skin cancers and how to proceed with their management. In the afternoon, I would have a theatre list, so this would include a mixture of punch biopsies, incisional biopsies, curettage and cautery, and also excision of lesions. On Tuesday, I would normally be on call, as well as undertaking the clinics shown here. So that would involve taking phone calls from both GPs in the surrounding area and also from the hospital wards themselves as well. In the morning, I would have the screening or 2-week wait clinic. So this is where all the suspected skin cancers are referred. Over lunchtime, we would have histopathology teaching, which is excellent for learning and going through slides of cases that have been seen during the week. And in the afternoon, I would do the emergency clinic. So this is a clinic that we run for any patients that have severe skin problems that need to be seen urgently. On Wednesday, again, I would either have general dermatology or a 2-week wait cancer clinic. Over lunchtime, I would go and see patients on the ward who require reviewing. And in the afternoon, I would have admin to catch up with patient results, patient letters, and to sort these out. On Thursday in the morning, I'd have a general dermatology clinic. Over lunch, there would be a board round, so this would be an opportunity to discuss interesting cases seen during the week, and it's used both as an educational event and also as an event where you can bring cases to the attention of other colleagues and consultants. In the afternoon, we would have regional teaching. Then on Friday in the morning, I would have admin. So again, to go through blood results, biopsy results, and to sort out patient letters and respond to any queries that might have come through. And finally, on Friday afternoon, I would have a paediatric dermatology clinic. As well as the in-hours work, I would also be part of an on-call rota, and at this particular hospital, we would cover 24 hours. So from the evening 5 p.m. cover would be provided until 9 a.m. and then the day person would cover from 9 to 5. Also at weekends, we would provide 24-hour cover on a rolling basis, which was probably around 1 in 7 weekends. The out-of-hours on-call cover is provided remotely, but we cover quite a large area, and it can involve some travelling around if we need to go in and see patients on the ward. What are the skills required to be a good dermatologist? Firstly, good manual dexterity is required. As mentioned earlier in this talk, we do a lot of procedures, so both in dermatology day theatre and also in clinic we may do procedures such as cryotherapy and intralesional steroid injections, which require good hand-eye coordination. Good clinical diagnostic skills are also necessary. There are lots of diagnoses in dermatology, so it's important to be able to narrow down differential diagnoses. It's important to communicate well with patients and to provide a good standard of care. As with any speciality, but especially in dermatology, treatment plans can be quite complex, and it's important to ensure that these are communicated well to the patient so that they are able to adhere to the plan that has been drawn up. Finally, you must be committed to acquiring knowledge and skills. So as mentioned, there are lots of diagnoses in dermatology, and there are lots of skills to acquire as well, so you must be willing to learn and continue to develop these skills. Here you can see the training pathway to becoming a consultant dermatologist. After completion of foundation training, you will need to do core medical training, or what is now known as internal medical training. For entry into dermatology at the moment, IMT 1 and 2 need to be completed, and the third year is not required. During this time, you need to complete the full MRCP examinations. So this consists of 2 written exams and a practical exam, as well as entry to dermatology training via internal medicine training. You can also enter having completed ST1 to ST3 of pediatric training, but if you enter dermatology training via this route, you need to prove competencies in adult medicine as well. Dermatology training itself is 4 years, ST3 to ST6, and during this time you will need to complete a specialty certificate examination which is required for CCT. Alongside the clinical training route, you can see the equivalent academic training route, and there is currently talk of an additional entry pathway to dermatology training via core surgical training, but this is yet to be confirmed. When considering applying to dermatology training, the ST3 application scoring, which is available on the ST3 recruitment website, is a really useful resource. This goes through each aspect of the application and how many points are available, and each section has a table like the one shown on this slide, which breaks down the different options and the scoring points available. This is really useful to plan your CV and your application, even in foundation years or as a medical student. You can look through this scoring to get a better idea of how you can maximize points and make your application as strong as possible. The application scoring does change year on year, so it's not concrete, but it is a very useful guide. And the average shortlisting score required for an interview is usually around 50 points. So you can have a look through the application and see how many points you have now and what you can do to increase the number of points you will have before you come to applying for dermatology training. The dermatology interview consists of 3 10-minute stations. So the first station is a portfolio station, essentially, where you have to demonstrate your commitment to the speciality and your suitability for dermatology. So this involves going through your portfolio. You may get asked questions such as why dermatology, what have you shown to demonstrate your commitment to the speciality, what is your biggest achievement, and questions along these lines. The second station is the research and academic medicine and professionalism and governance station. So it's broken into 2 parts. The first part consists of analysing an abstract. So whilst you're waiting to go into the station, you are given a short abstract to read, and on entering the station, the interviewers will ask you about this abstract and ask you to critically appraise the abstract and summarise what you learned from reading the abstract. The second part of this station is focusing on professionalism and governance. So you may get asked about when you have demonstrated professionalism and about governance issues. The third station again has 2 parts. So the first part is a clinical scenario. So you will be given a short blurb and a photograph and asked to talk through this. You will then go through your differential diagnoses, your investigations, and how you would manage the condition that you can see. The second part of this station is a communication or ethical scenario. And for example, this may be something along the lines of you have prescribed the wrong dose of a medication for a patient and the patient has had has had some problems as a result of this. How would you deal with the scenario? So it's important to talk through your approach in a stepwise fashion and to make sure that you cover all bases. There are lots of things that you can be doing to explore and to demonstrate commitment to dermatology if you decide that this is something that you want to do during medical school. When you're on your dermatology attachment, express your interest in dermatology to the registrars and the consultants. Speak to them about what a career in dermatology involves and what they enjoy and dislike about the speciality. By demonstrating your interest and showing that you're keen to be involved, you're more likely to be given audits and projects to be involved in, and these can lead to presentations and publications. There are also a number of essay competitions, elective prizes and project grants offered by the BAD, the British Association of Dermatologists, and there are also other societies such as the British Geriatrics Society, which run competitions that you can enter. As well as this, during medical school, there is plenty of opportunity to gain further experience in dermatology through student-selected components or modules and also through organising an elective in dermatology. The BAD run Derm School every year, which is aimed at medical students and foundation doctors who are interested in dermatology, as well as providing useful insight into the speciality and a good networking opportunity. It also shows that you're committed to the speciality. And when it comes to applying for foundation programs, jobs, try to apply to tracks which will have either a dermatology rotation or other allied specialities such as rheumatology, infectious diseases, plastic surgery, oncology, etc., as these will all be useful when it comes to applying for dermatology. During foundation training and internal medicine training, there are lots of things that you can do to explore dermatology as a career and build your CV. Contact the local or regional dermatology department and express an interest. This way you may be able to go along and sit in clinics and become involved in projects as well. Find a helpful registrar or consultant in the dermatology department, someone who can act as a mentor and guide you both with your application and also perhaps involve you in projects that they are doing. Try to take on projects, audits and presentations that have a dermatology slant to them. So for example, if you're doing an acute medicine job, try and do a project or an audit relating to cellulitis. If you're doing a surgical job, try and do something about wound healing. So there's always a way of trying to spin the subject so that it is relevant to dermatology. Try to present cases at regional, national or even international meetings. So the British Association of Dermatologists have an annual meeting, and as part of this, one of the sections is a historical section, and this doesn't require you to have any project or clinical experience with dermatology. Essentially what they are looking for is interesting abstracts on historical aspects of any dermatology condition, a famous dermatologist, or any kind of eponymous syndromes. If you do come across interesting cases, then try to write these up for publication. Maybe even ask your local dermatology department whether they have any projects or cases that are just awaiting to be written up, and volunteer yourself for these. Try to get involved in a research project if you can, because this will carry more weighting than a case report and could lead to quite a good publication, as well as providing you with excellent insight into undertaking research. Try to undertake taster weeks and, as I mentioned earlier, organised to go along for ad hoc clinics in the dermatology department. Again, you can organise a taster week by contacting your local or regional dermatology department and explaining to them that you're interested in a career in dermatology and would like to explore this further. More often than not, dermatology departments are happy to have medical students and junior doctors attend for taster weeks with some advanced planning. If possible, try to organise some dermatology training for medical students and other junior doctors. Again, this will give you the opportunity to learn more about dermatological conditions, as well as showing your interest in the speciality through undertaking these educational activities. There are lots of useful courses that you can attend. DermDoc is a very good course run by the BAD, which is aimed at junior doctors and internal medicine trainees in particular. And this is a one-day course that's hosted every year, normally around autumn time, by the BAD. As mentioned earlier, there's also the annual British Association of Dermatologists Conference, which is an excellent opportunity to network, meet other dermatology, prospective dermatology trainees, current dermatology trainees and consultants, and also to present your work and learn more about the field of dermatology. In hospital, and when you're organising taster weeks and ad hoc clinics, also try to acquire dermatology-related practical skills, such as taking a punch biopsy. This is a relatively simple procedure to get signed off, and it shows again that you're trying to acquire the skills that would be needed in dermatology training and would be useful to a dermatologist. So I thought some of you might be interested in my CV and what I did in the run-up to applying for dermatology. So I decided I wanted to do dermatology as a career relatively late, at the end of my FY2. I organised a taster week at the end of my FY2 year, which took quite a lot of persistence and planning, but it was a really good experience and gave me an insight into dermatology. As prior to this, my experience was quite limited, having done a week of dermatology in medical school and then having come across odd patients on the ward and when I did my GP rotation in FY2. Leading on from this, I also organised another taster week in my CT1 year to just again increase my exposure and to meet other dermatology consultants and trainees who could provide me with an insight into their career and also other opportunities that I could be involved in. I also undertook a taster week abroad, which was organised through the prof that I undertook my first taster week with. I attended a dermatology department in Belgium, which was a tertiary centre receiving referrals from all over Europe. And I got to see some really interesting things, which I probably didn't really appreciate at the time. But now looking back on that experience, I saw some really quite rare and interesting conditions. From a research perspective, I did a national poster presentation, which was actually at the BAD, and this was off the back of a project that I started with the consultant who I did my first taster week with. And following on for this, from the same project, I did an international oral presentation at the European Association of Dermatologists conference in Paris. And I did an abstract, which was published. That was something that I was involved with as an FY1 doctor, and that wasn't related to dermatology. So the other thing to say is that with the ST3 scoring criteria, none of the work or the projects that you have done necessarily need to be related to the speciality that you're applying for. It is helpful if you have done projects in dermatology, as it shows commitment to the speciality, but you can still get maximum points even if you've done the project in another field. So the other thing I had done, so case presentation. I presented 2 cases as posters at an international meeting, which again was the EADV, and I also did a regional oral presentation at a dermatology society meeting where they presented patients with complex and challenging cases. In terms of courses, conferences and meetings, I attended derm school quite late, so I attended this as a CT1. I attended the derm doc course, which I've mentioned earlier, as a CT1. I attended the British Association of Dermatologists conference. So initially, the first time I attended this, it was more to find out what the conference was about, and it was a very useful networking opportunity, and I met some great people there who I am still in touch with today. I also went to the European Association of Dermatologists conference, which I've mentioned was in Paris, and I attended the BEES course. So this is the Better Evaluation of Evidence and Statistics course, which is run in Nottingham. It's actually aimed at dermatology trainees, but I was recommended this course as a good resource for preparing for the research abstract part of the interview, and I found the course really interesting and also very useful in helping me to better critically appraise material that I read. Teaching is a big interest of mine, so I started studying for a master's in medical education at the end of my FY2 year, and I also delivered various teaching to final year medical students and to foundation doctors. So as part of an event teaching ENT, ophthalmology and dermatology to final year students, I did the dermatology aspect of this course. I also have delivered teaching for FY1 and FY2 doctors on dermatological emergencies. From a leadership perspective, I was a Royal College of Physicians Trainee Committee representative for my region, and I also was a skin charity ambassador. During medical school, I was president of the Careers Society and also MedAid, which was a charity society which sent medical equipment abroad. So as you can see from this slide, I had done a fair amount and variety of things, but I didn't have any research publications. And I just wanted to highlight this, as sometimes applicants can think that research publications are the be-all and end-all, but this is definitely not the case. And as long as you focus on finding out more about dermatology and exploring the speciality through other means, then this is more than enough. Ultimately, when it comes to the application, the portfolio part, so the point scoring part, is actually only a small proportion of the overall points. The interview is a much more significant proportion of your overall mark, which counts for your overall ranking and whether or not you are offered a dermatology registrar post. So just to summarise, hopefully I've demonstrated that it's never too late to consider a career in dermatology. I decided relatively late on that I wanted to do dermatology, and this didn't negatively impact on my application. Dermatology is a very diverse, practical and exciting speciality, as I've hopefully demonstrated through this talk. And my top tips for those wanting to apply to dermatology would be, firstly, to use the ST3 scoring criteria as a guide to plan out what they can do to improve their CV and increase their chances of getting an interview. Secondly, it's really important to get to know your local dermatology department and to acquaint yourself with the dermatology registrars and consultants there, as they can provide you with a wealth of experience, insight, and also opportunities to build on your CV and to further enhance your experience in dermatology as a field. And finally, seek out and attend relevant courses, as not only will the course content be useful and show your commitment to the speciality, but it's also a great opportunity to network and meet others who are considering a career in dermatology. And rather than considering other potential dermatology applicants as competition, I think it works quite well actually to work together. And that's certainly what I did when it came to preparing for the interview. I and two of my colleagues who were applying for dermatology actually practiced for the interview together, and we all succeeded in getting a dermatology post in our desired regions, which was really nice and goes to show that teamwork is the way forward. So hopefully you found this talk useful and it's given you some food for thought. I've listed some useful websites on this slide which may be able to direct you to useful events, courses, and also some of the essay competitions that I mentioned earlier on. If you have any questions, then please feel free to leave these in the comments below. And if you have any requests for any further videos that you'd like me to do, focusing perhaps on a particular aspect of the dermatology application process, then please do let me know. So if you found this video useful, please like and subscribe to keep updated with new videos that I'll be releasing on a career in dermatology and on dermatology as a subject itself.